Good morning, everyone. Thank you, Derek. And thank you, everyone, for being here this morning and joining us for our virtual conference. And I am the problem gambling coordinator and counselor at Meridian Healthcare. And I'm just going to give you a little background on Meridian Healthcare. It's a nonprofit agency located in Youngstown, Ohio. And we have remained committed to encouraging responsible play and bringing awareness to problem gambling through our prevention and outreach efforts. We also offer a gambling treatment program that is an outpatient basis that includes group, individual, and family counseling services. So I do want to introduce our speakers for today, which is an honor for me. They're going to give us some really great information into adapting our programming during the national pandemic. These speakers are coming from all different areas of Ohio and coming together to provide this presentation for us today. And they have remained committed to providing education, outreach, treatment, and advocacy for problem gambling and promoting responsible play. So again, it is my honor to introduce Ashley Hartman with Nabil County, Lauren Munk with CHC Addiction Services, Nabil Pervaiz with Recovery Resources, and Claire Spada with Lake Geauga Recovery Centers.
All right, is that my cue? All right, I will go ahead and get us started. Oh, was it not?
Yeah, you're good to go.
So as they say in 2020, I'm going to share my screen. Excellent. Share. Bring up our presentation for today. All right, does it look good, everyone?
You're set and good to go.
All right, thank you. So thank you, Stephanie, for introducing us. I'm so glad to be here with everyone and all of my fellow presenters here today. We all have a lot of different information and come from very different agencies and programs. So hopefully there'll be something here for everyone that they can take back and help support their programs locally. So our title there, Innovation and Prevention Recovery Programs during COVID-19. And as Stephanie introduced, our different presenters. So let's start by discussing how COVID-19 impacted the problem gambling landscape in the past year. So we saw some increase in risk factors, things such as isolation and overall increased mental health challenges that could impact substance use and gambling behavior, and not being connected to our social supports. That's definitely been a challenge we've seen. Some specific concerns, increases in gaming, which Claire will discuss much more further in detail. Casino access during the pandemic. So those who were casino gamblers, with the closing of the casinos during different points of the pandemic, how that might have impacted their behavior. Stimulus checks, increase of access to money to be able to gamble. So I wonder if folks have observed that in their local communities as this next round of stimulus checks coming out, and increased risk of suicide. So I'm gonna go to our next slide and let Claire discuss some of these gaming impacts during COVID-19.
Absolutely. So hello, everyone. So these were some things that I was able to find. And I will say that they're all from the very early pandemic stage. So a lot of these statistics are from like March to July of 2020. So like right in that very beginning stage. I haven't seen any new statistics, but I would be certain that they would probably change quite a bit if we took a look at them again. So a couple of different statistics on this slide. So you'll see that there was a research company that started taking a look at video game sales. And specifically just in North America, we saw that the sales of video games were up 34% from the previous year. We also saw video game hardware. So I don't want to use terms that, everybody should understand. So video game harm, where we're talking about like buying a Nintendo Switch or an Xbox or a gaming system of some sort. So that went up 63% in the past year. We also saw that twice the number of units of the Nintendo Switch were purchased. Also during this time, in the very first quarter of 2020, we saw that the United States was up 9% for entire spending of video gaming compared to the previous year. And then in July of 2020, again, so at the very beginning stages, we saw that total video game sales of hardware and software within the first 6 months had been the highest of sales since 2010. So we are definitely in an age where we're seeing just a huge increase in video gaming, in access. And I'm sure it has a lot to do with the fact that many of us were asked to work from home. A lot of schools were closed down. So young people were at home with virtual learning that probably was a little crazy for a while, and trying to kind of deal with their own coping strategies and things like that. And I think in addition to that, Ashley had mentioned stimulus checks. So I think that, people who were maybe financially in an okay position, who are now getting stimulus checks, said, you know what, how can I spend some additional funding? What kind of entertainment can I do? Because I literally can't see anybody. There's nothing's open. I can't go anywhere. And so I think this is just an assumption from me. I assure that we saw a lot of people spending some of that extra funding on entertainment through video gaming. Ashley, if you'll click. So we also have a couple of other statistics. So Steam, if you're not familiar with it, it's basically, it kind of looks like a website that you can go onto, and it's a place where you can purchase online video games. And a lot of people can come on and play through Steam all at the same time. And so it's basically a digital storefront for video games. So they saw over 23 million concurrent players during March of 2020, which was the largest that they've ever had in the history of Steam. There's another service that is called Twitch, and it's basically where you can go onto Twitch and you can watch people play video games. And so Twitch saw over 3 billion hours of content watched during the first quarter of 2020, which was a 20% increase from 2019. And then Microsoft also reported a substantial increase in users in their Xbox Game Pass series in the months of March and April 2020, bringing it to over 10 million subscribers. So these three in particular, we definitely see, again, that huge increase in people having access, having funds to be able to spend on it, and finding a way to be entertained and to pass the time and to be engaged during that early pandemic stage. Ashley, if you'll click. So this was also a really interesting thing that honestly, I had no idea that this was a thing until I started digging deeper. And I'm just going to kind of read through it. So the additional bandwidth from video games and other internet services created concerns that critical bandwidth would not be available for medical and other key infrastructure elements necessary to mitigate the spread of COVID. So I just think that's incredible that the video gaming industry and all of the internet usage and the bandwidth and the things that were needed to prevent the spread of COVID was being impacted by so many people engaging in video gaming during that time. And so there was a company that's called, and I probably am pronouncing this wrong, Akamai. And so what they did was they are basically the network for a lot of video games. And they took a look at video game storefronts like Xbox Live, PlayStation, and Steam, and they decided that they needed to step in and actually cap download speeds and encourage users to download at off-peak hours. And they said, okay, you can't not download this during the daytime. You're gonna have to do it night or do it at times when people aren't doing it that often, and you can only download so fast. And they all did that because it was impacting people's abilities to actually to stop the spread of COVID during that time.
Anything else you want to add before I switch over here, Claire?
I don't think so. I do think, I guess I will just say, if you're newer to the field, I know that we didn't go into super in depth about gaming and gambling and the connection between the two, but I do think that if you're not familiar with things like loot boxes or microtransactions or the various gaming and gambling connections, the different capacities that we see in video gaming, there are definitely a lot of great resources out there. I think Change the Game Ohio is a really great resource to look into. And there's just a lot of really interesting information that we're seeing about the connections between gaming and gambling. And so, I would say that when we do see an increase in gaming, that we could probably assume that there's probably also an increase in the gambling activities that are inside of those video games. So something we should definitely be concerned about.
Thank you. And feel free to use the chat. We love to hear from all of you. That's one of the nice things of these online trainings is to see the chat. So feel free to share with us. Have you seen, either as a clinician or preventionist or community member, changes in the way that folks have engaged in gambling or gaming behavior during COVID-19? Folks using more of the online services, having access to money through stimulus checks, things such as that, other mental health symptoms worsening during COVID-19. Something interesting that we noticed is that our recovery folks, so folks living with mental health conditions and our support groups early in the pandemic, expressed that because they've been living with their illness, they're in recovery and have a lot of recovery tools, they felt early in the pandemic they were more equipped than folks who might not have had those type of resources to deal with the isolation or other changes they experienced during COVID. Though as COVID continues, it really became more heavy on them, more challenging, more difficult, things such as that. So that was one interesting response that we saw. A lot more indicating they've been playing games online with friends. That's something just anecdotally I've heard in regards to young people staying connected. And it's interesting too, I love TikTok. That's just the way I am in the world. And that app, which has short videos, is typically for young people, which we know is our high risk population. I logged on today and I've been getting a lot of FanDuel ads. And one of the difficulty with Instagram, or definitely I'm noticing now that TikTok has ads, is that they're difficult to discern if they're an ad versus a user video. So it's interesting how that's being embedded. Those ads are being available to young people, and they're pretty not clearly an ad, if that makes sense. So I think that's definitely an impact some behaviors, especially as we're entering March Madness, things like that. So I'm going to go into some of the ways we adapted our programs here at Nabil County in response to COVID-19. So the first step was converting everything to online programs. So since March, we've been doing our support groups, classes, and all their programs online. And as many other folks experienced, it was a challenge to suddenly change all your programs, also when staff are going from an in-office environment to working remotely. So that was kind of our first piece, and something we noticed was in some of our rural areas, there are some internet connectivity issues. So that was definitely one concern that we had. And I know a lot of our treatment agencies were able to get tablets for their clients, so they did have some access, but I know, and feel free to comment on this for those that are clinicians, they would sometimes have a tablet, but it didn't have a data plan. So again, if there are the internet connectivity issues, that could be a challenge for folks. A big barrier we faced was the hesitancy to engage in online programs. And there's a couple different reasons why. The reoccurring thing we'd heard here is people say, well, I'll wait till this is all over. We have folks that call every month and say, when are you coming back in person? And so that just isn't the way our community was used to engaging with us. They would come into our office. Typically, that's how folks would participate in classes, support groups. So having to seek our information and programs online was definitely a change in how we engaged in the community. What I will say is, as we had that dip in participation early last year, so around this time last year, March, April, May, we have seen in January an uptick in people participating again. Another challenge was that in transitioning to programs online, us as staff and our volunteers had to learn new systems. So using GoToMeeting, and now we use Zoom for our classes. So for many of our folks, that wasn't something that they were used to. There was also hesitancy with our facilitators to offer the classes online. As many folks have probably similarly experienced, there's a concern of the fidelity, or maybe a better way to describe it is the impact programs will have that are now being offered online, especially NAMI programs, which provide information and education, but also the key component of it is to developing community support and those relationships between people. And is that going to be lost in an online format? So there's a lot of hesitancy there. One example for those, I assume there might be some folks here on the call that are doing mental health first aid, the transition to doing it virtual. And I could do a whole separate, hour-long conversation around some of the technology challenges there. In addition to them rolling out an updated revised curriculum, in addition to now offering it virtually. So learning those systems was a challenge unto itself. Something else we noticed in Wood County is that in the beginning of the pandemic, there was a huge increase to crisis calls. So I can't remember the specific numbers, but there was a significant increase in calls to our Wood County crisis line last summer and early spring. Huge increase. So for NAMI, who works more, I always say it's the orange slice. I think another presenter this week called it the protractor of, you have your health promotion, prevention, treatment, recovery services. For those of us living on the recovery side, what we're expecting is an uptick in need for services later in the pandemic. So for example, at NAMI, we offer education classes for family members of loved ones impacted by mental health conditions. Those loved ones, or excuse me, those family members, I would expect are also the folks that are dealing with doing the virtual school and homeschooling. So they're doing a lot of that kind of immediate support. And so being able to come to a voluntary class once a week in the evening, that might not be available to them until as we progress in the pandemic. Seeing some chats, I'm just interested in kind of seeing what folks are talking about. Increase in anxiety among kids. Yeah, it's very difficult explaining the pandemic to young people. How do you describe this virus and understand that? That's a really excellent point. Correlation of increased gaming as translating to increased gambling. That's a great question. And if we don't have that information today during the presentation, that would be a great thing to follow up on. Connectivity issues with tablets, seems like a lot of folks. And here's an interesting challenge I'm now trying to figure out how to navigate. So we finally got the money for the tablets and the data plan, but now the tablets are sitting here and it's like you're running down the clock of paying for this data plan and you're trying to get it distributed out into the community. So it's kind of an interesting thing to navigate. Yeah, discovered greater participation. Yeah, in-person participants go home and then they go out again. Yeah, so in some ways it could increase participation. And one thing I'll mention here too, as we talk about adaptations, because we're offering the classes virtual, we can now have participants from other communities, even out of state. So I kind of define it as a rising tides lift all boats, in the sense that if we have folks coming to our programs from other communities, let's say we only have a few folks here locally, and if we only had those folks participating, we wouldn't have enough to host the class. So because we have additional people participating, we can still hold the class. Folks are still developing really meaningful, supportive relationships. So I think that that's really great. Going along with that, we're able to have volunteers or facilitators outside of the community. We had a great experience offering our Wellness Recovery Action Plan class, and we partnered with folks out of NAMI, Wayne Holmes counties. And so we had some wonderful volunteers. Kind of half of our participants were from Wood County, half from Wayne Holmes, and they had a really positive experience. They hosted a talent show at the end of their class. They're going to continue meeting. So I think that that was a really great experience we had. Identifying what types of online platforms we're going to use. I found I enjoyed using Zoom better than GoToMeeting. So just figuring out what's going to work for you, your participants. StreamYard is a great program. I'll talk later about some of the live streams we've started doing, and that was a really good platform for that. There was different opportunities for grant funding to purchase technology that we were able to benefit from and address some of those internet connectivity, working from home. Yeah, and I think one of the barriers I'm seeing in the chat is when those grants are geographically defined. So I think something to potentially talk about with funders is, again, how you have a program, you're ensuring that availability is prioritized for folks in your local community. If you can have folks participate from other communities, how that actually might enrich the program that you're offering. So that potentially could be one conversation to have with funders, but we often do live by those county boundaries or however our funding entities are set up. Excellent. So we did do a drive-through event. I know a lot of folks are doing drive-through events, trunk or treat type events, and that was really successful. And typically during the holidays, we have a social event. We offer dinner around Thanksgiving and Christmas time. And so instead we did a holiday gift campaign, offering that to our local recovery houses and adult care facilities. So I wanted to share with you all, going to start, let's see. It's going to take a little technology strength. So I am going to do a new screen share and show some videos. All right, share sound. So we received funds from Ohio Moss to offer a public awareness campaign, and our target audience, we had two, the farming community, as well as first responders, each of those having some unique risk factors related to suicide and other mental health challenges. So I'll go ahead and share with you all one of our videos. And if any of my folks that are panelists, if you can give me a thumbs up or even do it just with one of the reactions that the sound is working.
With uncertainty of weather, commodity prices, and injury, it can often leave farmers wondering, am I going to get through this? How will I support my loved ones? When will the stress end? Farm stress is real, but so is rural resilience. If you are concerned about a family member, friend, neighbor, or yourself, reach out for support. In Wood County, there are many ways to connect with help.
You work hard to
For the sake of time, I'll just show one of our videos, but I'll put in the chat the link to our YouTube page where we have all of those posted. So those ran in local markets. Again, we had campaigns for the farming community, first responders, and then type of blended message for the two audiences. Here are some examples of the printed ads that we had. We used things such as social media, Spotify, Pandora, and it was helpful early in the pandemic. We had some funds from our local Adamus board to do, excuse me, the phone's ringing, to do some outreach around mental health and COVID at the beginning of the pandemic. So we started developing relationships with our local news stations that we're able to leverage when we have this funding for this awareness campaign, which is wrapping up soon. Increased social media. We started doing a weekly news at 2. So we'll call it NAMI News at 2. We do it every Tuesday at 2. A lot of alliteration there, which we're into. So you can see some screenshots there of our videos, and we like to have fun with it. We'll do theme days. You can see the bottom there was our holiday one. what did we do most recently? We did Harry Potter's birthday, Mickey Mouse's birthday, a lot of fictional characters' birthdays. So if you have a favorite fictional character you'd like us to feature, we'll see if we can fit that in. Also those awareness, Brain Injury Awareness Month was this month, so I know that was something we discussed. Mentioned the themes, and also early in the pandemic, we did videos with our local provider agencies. So again, that's all available on our YouTube channel if you want to view that and get some ideas. We recorded the videos in Skype, was actually where we recorded it, and then we fortunately had an intern that helped us create that. And if you visit our YouTube, we didn't have a YouTube until March 2020. So you can kind of see how there's an opportunity during the pandemic when you weren't able to do in-person programs, you could focus on some of those other types of projects. Okay, so just gonna check the chat real quick. Great, well, thank you everyone. It's so nice to hear your feedback and feel like we're not just talking into the void. I'm gonna go ahead and turn it over to Lauren to share how they've been doing their youth programs. Lauren, take it away.
Awesome. Hello, everybody. I'm Lauren Munk. I am the prevention coordinator at CHC Addiction Services in Akron, which is in Summit County. It's been a challenge, just like for everybody else. I would love to see how many people in the chat are doing things with youth, just to kind of get a little idea, and I'd love to hear some of your feedback as I go along. But we started off I'm going to jump down to the youth-led programming that we do. We have Summit County Youth to Youth is our youth-led program. So we kind of onboard our youth for the year in August, and we started training in August, and that's when we kicked it off. And we actually had an overnight retreat planned, and we kept, like I think everybody else at the time, just pushing it off and like keeping our fingers crossed that we could do it. And then at the last minute, we just decided we can't. It's just, even though we had 12 youth and we could keep distance and things of that nature, but we had to travel down, and it was just better safe than sorry. So we had to kind of convert that and be innovative with our youth-led programming. We are lucky that in our facility, we did have a large space and we didn't have a lot of youth, that we were able to meet several times in person to do programming with them and to kind of start a training. Come November, we decided we needed to step back, and we did the virtual platform. We used Zoom at the time. And then we started resuming in person again in February. But it's been very difficult to engage them. I think they've had, like everyone else, Zoom fatigue. So it's been a challenge, but they're actually starting to come up with some great ideas. They actually decided they wanted to start doing a podcast. So we're starting to develop that. We're looking into doing a new vision and mission statement for it, because it's kind of changed and of that nature. So that's been a real challenge. Our school-based programming, however, has kind of kicked off. A lot of schools have not let us into the building, and that's primarily because they're getting settled. They were trying to figure out the logistics of their students, of their staff, and that type of thing. So mainly with the schools, we use Google Meets. We do also use Zoom, but Google Meets is our primary function. And like everything else, there's difficulties, links expire, especially with Google Meets, the links expire, but they have to resend them. But it's actually worked out pretty well. And now that Google Meets has breakout rooms and polls, so it's a little more interactive. A lot of time we do utilize the chat. And I will have to say, the nice thing about being in the virtual setting is if the kids are having that banter or the constant disruption, they're muted, so you can just continue on doing your programming. But it's nice. It's amazing how many of the kids the students actually utilize the chat and are willing to talk and have a conversation. So we've had some really great conversation. We do the evidence-based program Too Good for Drugs from the Mendez Foundation. But with this, we've actually been able to do more gambling programming because the teachers are willing to give us an extra day or two. So actually I did the smart choices with the school, and we had an extra day, and he's like, yes, I'd love to see what you have to offer. So it's been an awesome experience because we've had success with it. Let's see what else. We've also realized that having the computers, each kid have their own computer, is much more useful than the teacher projecting it. I don't know if anybody else has had that experience, but with the kids on the computer, they can utilize the chat. You can actually see them if they turn on their cameras. So it's been a great experience in that way. And a lot of teachers are very compliant, and most kids now have computers that they use. So we try to make things as interactive as possible. I don't know if anybody's familiar with the Mendez Foundation Too Good for Drugs program, but there's a lot of, partnership activities and games and things of that nature. So not being able to utilize those things, we've had to be creative using the Kahoot. Kids have taught me, there's this great website called Blook It. It's in my resource thing. It's been wonderful. The kids love it. So it's just something new. I use something also called Trivia Maker. So you can do a Wheel of Fortune, a Jeopardy style game. And then ccg.buzz is a way that they can interact by clicking the buzzard and who clicks first and things of that nature. And then Claire was talking about the STEAM programs we've been utilizing Jackbox games for our youth to youth clubs to kind of get them engaged and interact and start conversation. And then we typically do our education piece after that. And then after our education presentation, we do some type of Kahoot, Blook It, or Trivia Maker to reinforce what was learned. So in addition to that, it's been really interesting. We've also do youth to youth clubs in the schools. So typically we would meet once a month during lunchtime, and we've had to go online. So the nice thing about it is we have kids from different schools interacting with each other, which you can't do that if you're in one lunchroom, so it's been very neat meeting kids from schools and the kids meeting each other from different schools and engaging. So that's been a great experience with that. So I think that is all on the youth programming piece. So it's that engagement piece that we really try to push, and we try to bring them in by doing some type of game or activity. And from there, we can do our education piece. So excellent.
Right.
I work for CHC Addiction Service in Summit County. I see your, and then, hey, Larry, yes, I'm just reading the chat, but yes, working with Summit County Community Partnership to doing a collaboration with them, working with our youth and doing marijuana fast facts for a campaign that they have with, I believe it's Prevention Action Alliance. So great. Joy, I'm going to have to check out your Mentimeter, see how that is. So awesome. Well, thank you, everybody.
So some folks asked for the YouTube link, so I'm going to go ahead and put that in, and also pull up. We'll be watching some videos from Recovery Resources, so let me pull that up as well. So I'll put both of those links in the chat so you are able to access those. All right. So let's go back to our slide deck here. And I would like to toss the baton to Claire.
Awesome. And if I can just give extra props to Lauren. So Lauren and I have, I actually used to work for Lauren for several years. And I truly believe that Lauren has been able to do a fantastic job of integrating drug and alcohol prevention and gambling prevention. And she's one of the few people that I know that really is able to rely on the relationships that she has already built within schools to really be able to do both types of programming. And really their youth-led prevention and all of the programming that she does is really, I think, the most ideal way to approach problem gambling prevention with youth. Because if any of you have done problem gambling prevention with youth, you'll know that once you start talking about that with schools, a lot of times they'll shut you down or tell you it's not a problem or whatnot. And really, I think the most successful people have been able to do drug and alcohol prevention first, because many schools are welcome and open and want you to come in and do that type of programming, and then be able to integrate additional problem gambling information and knowledge around that. So just my 2 cents that I think she does a fantastic job. So my name is Claire Spada. I work for Lake Geauga Recovery Centers. So I am up just east of Cleveland, very, very close to that area. And my role currently is 100% problem gambling prevention. So I do problem gambling prevention in both Lake and Geauga counties. So I have 2 different boards that I report to. And I primarily do a lot of my services for adults, although I am very much working hard to do some youth programming as well and to kind of expand our services. So I wanted to share a little bit about what I'm doing in regards to problem gambling prevention in my counties. So the very first thing that I have on the list are something that I actually learned about from Beth at Origo. I don't remember how to pronounce it, but you got me. So she's actually speaking this afternoon, and she is a fantastic person. And she is kind of has this huge, great marketing background. And when I approached her and said, hey, listen, I want to use the Change the Game Ohio campaign. And I want it to be personalized and have all of our information on there. And I want to be able to utilize it. She said, have you looked into display ad campaigns through Spectrum? And at that time, I was like, I don't even know what you're saying. Like, that's all foreign language to me. And what I basically learned is that if you're surfing the internet and you see advertisements on the sides of your screens, a lot of times those ads are placed there by Spectrum, and people pay for that service to be able to have it pop up so many times. And when you click on it, it'll take you to wherever they have set it up that you want them to go to. So I did Spectrum ad campaigns with specifically that campaign. And the great thing about it is that if you're looking for something that's measurable, so originally when I said, you know, we have some budget money and we want to use it for marketing, we looked into movie theater campaigns, and it started out as a really great idea, but then we really realized that we had no way to determine how many people were actually going to be able to view that. And this was all right around the time when movie theaters were like starting to kind of close, and we were like, I don't know, like, should we not? You know, how many people are actually seeing movies right now? And we really thought that Spectrum ads were perfect because everybody's at home, everybody's able, you know, everybody's on the internet all the time. And we could really select specifically who we wanted to engage in that campaign. So we gave them a list of the zip codes of people that we wanted to access it. We gave them ages. We specifically said we wanted to target parents. And so they were able to figure that out. You could also potentially target gender, education, or income if you wanted. And then they have basically an indicator of if this person has kids or no kids. The really great thing that I thought was that they really worked within our budget. So last year, at the end of our fiscal year, we had about $1,500 that we really wanted to spend on a campaign. And I said, here's what we have. And they said, okay, based on this, you can do a campaign for about 2 months, and you'll probably get about about 52,000 impressions each month for that type of campaign. And if I would have had more or less, I know that she would have been able to incorporate whatever I was looking for. So that was just a really nice way to not have to rely on, a really ridiculous or really crazy, unrealistic amount that they would expect us to pay for certain marketing things. So I like that it was really flexible. And we did ours in June and July of last year of 2020. And you can see that we had a CTR, stands for click-through rate, of about 0.06. And it sounds really small, but apparently what I've been told many times is that that's really in line with other types of campaigns that are very similar to ours. So like healthcare or social service campaigns. And so we ended up with about 83 people of those 52,000 plus impressions over those two, for each month. 83 people ended up clicking through, and they were then taken to our Lake Geogga Recovery Center's youth gambling page, where they could then learn more about the campaign, and we could track that information. And it was really great because after we were done, they gave us a huge report that said, hey, here are the zip codes that were more likely to click through. Here were the, just the population. Here's how many people saw it on your phone versus a tablet versus a desktop. And not shockingly, the most number of people saw it through their phone advertisements. But that was a really great way for us to be able to spend down some funding and to reach people in a new way. And I did not put this on there, but I will say that we actually, I think it starts today. I reached out to Spectrum again this year, and we had about $2,000 to be able to spend this time around. And we are actually doing 30-second video campaigns with the statewide campaign Set Before You Bet. And they are going to go on during several March Madness games. And I think it starts today, I want to say. And so at the end of the next couple of weeks, we're going to get so much exposure during the March Madness games locally. If somebody has Spectrum as their internet provider and their cable provider, and they're watching a March Madness game, our ad will show, and we'll be able to see how many people had access to that. So I'm hoping that we'll have good results from that. I don't know what that will look like, but something new that we decided to try this time around. So a couple of other ways that we really reached people were social marketing campaigns, and we relied on a lot of the national and statewide kind of campaigns that are typically going on. So in September, there's Responsible Gaming Week. So there's actually a toolkit that you can use for that. So if you kind of Google Responsible Gaming Week, typically that's a time when we would reach out to our local casinos and be able to partner with them and sit down at tables within their facilities. Obviously, that did not happen in 2020, but being able to promote some of that information on social media was really great. Another campaign that we always promote during the month of December is Lottery Tickets Aren't Child's Play, which is the National Council on Problem Gambling's campaign. And it's perfect because it's right around that time of year when people think that giving lottery tickets for Christmas is really a great idea. And so it does some education around some of that and how young people are more at risk for developing a gambling addiction and that kind of thing. During Suicide Prevention Month in September, we also do, within our agency, we'll do a lot of so we are a drug and alcohol and gambling agency. And so we do a lot of stuff just about mental health, drug and alcohol use, and gambling, all related to suicide during the month of September. And I do think it's always a great time of year to make people aware, because gambling addiction does have a much higher suicide rate than most other addictions. I think that all other addictions is at least what the research shows. So that's always a time when we hit extra hard on our social media with some of that information. And then I hope that you're aware that March is Problem Gambling Awareness Month, but that is a time when we also utilize the toolkit that they have. And we have Facebook as our primary thing that we use. I will also say that during Problem Gambling Awareness Month, we utilize our Twitter a lot more, and the National Council on Problem Gambling has all of that set up for you. So all you have to do is just copy and paste that information into your Twitter or your Facebook, and you can just utilize that really fast. You don't have to create anything new. So that's something that we really love. Another program that I was able to do was a parent program. And for those of you who are really interested in the connection between video gaming and gambling, I created a presentation called Gaming, Gambling, and Youth. And I've utilized a lot of the things that I've learned from the wonderful people that are in the field and people that I've sat in on presentations on and research that I've done. And I did several virtual trainings. It was really great because we actually had a lot of professionals who worked at a lot of our youth agencies also attend. And I actually had a lot of great feedback from it, and I will probably be doing another one, a repeat of it here at the end of March or at the beginning of April, because it went over really well, and I had several people who wanted to attend it and who did not. And really the biggest things that I did and talked about were just the connections between gaming. I introduced the concept of loot boxes. I talked a lot about what kind of games feature loot boxes, some of the research that shows that those kinds of purchases can be risky. We talked about parental controls. So how can you make sure that your child's not using your credit card for things that you're not aware of? How can you read further into what's it called? Like when they have like their rating systems, like how can you read further into the rating systems and really understand what those are saying or what they're being exposed to in them? And so a lot of that was education specifically around that in particular. And I will say that especially during COVID, one thing that I kept in the back of my mind during these presentations were, because I have my own 4-year-old, is to recognize that like screen time right now, sometimes you just have to let go a little bit. Like, you know, during normal times, I think most parents would say that they don't want their kids on their phones, on a tablet, on their screens all day long. And during COVID, you just kind of got to let that go a little bit sometimes. And so I think it's really important not to like screen shame. I don't know if that's a word, but I just coined it. Like, it's really important just to keep in mind that social media is a really great way to connect. Gaming is a really great way to connect. You know, even Lauren was saying that they use the Jackbox games, which my family has used as a way to like play games together, board games together at virtual settings. I mean, there are so many great things about technology that have allowed us to all stay sane during this time. And I think it's important to recognize that it's okay to stay connected to people with those types of things. However, there is that balance and that fine line and that understanding that sometimes a lot of parents don't recognize that there are some risks that are associated with certain purchases. And there are risks associated with excess screen time and not getting sleep and mental health being compromised. And so sometimes parents do need a little bit of information just so that way in the back of their head, they really know what their kid is doing and what they're being exposed to. So that is something that I thought was something that I have found some success with, is having that conversation. Sorry, I'm popping into the chat because I see things popping up quite a bit. Lots of good things about Spectrum and utilizing things that way. Treatment agency, the yearly exchange was a couple of counselors who would give lottery tickets. Yeah, that's always an interesting conversation as well. I've definitely worked at a couple of places who during Christmas time, they would have like lottery ticket baskets. And it was like an agency that provided gambling services. So sometimes that's an interesting conversation to have as well. Awesome. Okay. Oh, I work at Lake Geogga Recovery Centers. Ashley, if you wouldn't mind clicking to my next slide. So a couple of other things that I've been able to do during this time is really rely on the local coalitions that I sit on. So I probably sit on at least a dozen coalitions through both of my counties. And the ones that I have found that I've been really able to integrate problem gambling information into is suicide prevention coalitions. So I have found a lot of great partnerships and been able to bring a lot of awareness around gambling and suicide. And we also have several prevention focused, just general prevention focused coalitions. And as there have been two coalitions that I've been a part of that I think have really utilized their time well and been able to help me further some of my information. And that is those who are providing united social media messages. And so we actually had several people on these two different coalitions who got together and who were able to create some Facebook and Twitter and Instagram social media messages, and they created like a template and they said, okay, everybody on the coalition, here is the same message that we are putting out every Monday for the next 4 weeks. And so every single agency would take that information and there would be captions or whatever, photos, and we would all push out the same information. And so a lot of it was around the Strive for 5 challenge. But we also did a lot of promotion of local resources, of different types of mental health services that people can access and be a part of. We talked about some of those kinds of things. And that was, I think, probably one of our more successful ways to be able to continue to do coalition work from a virtual standpoint. The other program that I do a lot with is QPR. So this has been a really fantastic way for me to be able to reach brand new people. So if you're not familiar with QPR, QPR stands for Question, Persuade, and Refer. And it is a suicide prevention program, typically about between an hour and a half that you can run. And it is intended for people who have no experience working or being around people who are talking about suicide. They're not professionals. We're talking about educating regular people on how to have the conversation with those in their communities that they care about, that they think might be at risk for suicide. So we talk about warning signs, and then we talk about how do you ask the question if that person that you care about or love is thinking about suicide because you might be worried about them, and how do you get them help? It's fantastic if you've not ever seen it before. But I do it in both of my counties, and it is something that I've been, both of the local Adams boards who support me have found it really helpful. Every single time that I do a presentation, I talk about the risk of drug and alcohol addictions, but also the risk of gambling addiction as well. So it's just a new way to kind of throw that in there so people start thinking about that and recognizing that it's legitimate and it can be a concern. There is a license that you would need to provide it virtually that one of my local Adams board partners that I do it with has obtained. And so we were actually able to do many QPR presentations for the directors of our local senior citizen facilities, for several faith-based organizations. We actually also did it for local community college students and faculty. We did it for a local veterans group. Several of our mental health and drug and alcohol agencies do it for their new staff. So we've become part of that rotation. And so we've done a lot of those virtually. And again, it's a new way for me just to talk about gambling throughout that presentation as well. And then I've also done it in person several times. I had a request from several of our local school districts to be able to provide it to their teachers. And then we also have been doing it within several school districts as well. I actually had some recently where people were, there were several students who had attempted suicide. And so we came in and did a QPR presentation for some of their classrooms after that time as well. And so I saw Lynn asked if clergy are open to this kind of information. And I will say yes. So we have several of the ones that we've done. I've done a couple of in-person with some of the faith-based communities and some to some virtually. Sorry, my brain stopped working for a second. Both groups were very open to having the conversation about suicide. And actually, Mike and I and Stacy Fernapelhassen, we did an in-person faith-based focused QPR/gambling training 2 years ago. So this was pre-pandemic. And we had probably 20 plus people in the room from our local districts. And so they were able to get some more education about gambling, but they also got QPR information as well. And I think the QPR information probably drew them the most. So we always kind of led with, you'll get QPR, and then we're also going to talk about gambling. But again, it was a new way for us just to talk about that and have that conversation. So I did find that our faith communities were open to that. At least, again, approaching it from QPR is the main thing. And then here we'll throw in some splashes of gambling prevention and information as well. And then the last thing on my list is I always go into all of our treatment groups within our own agency and in outside agencies as well. And I have been able to utilize and jump into all of their Zoom calls. And because we always try to do pre and post tests, I've been able to utilize SurveyMonkey to be able to gather some of my data. We also use the BBGS screening tool whenever we do it, whenever we do presentations and groups. So that's another way for us to continue to screen people, even though we're not seeing them as in person as well. So I just enter all that into my SurveyMonkey. I wanted to add two other things because as I was sitting here and thinking about what else I've done virtually and that has been helpful, that I did not add to the list. So one thing that I actually did was I actually partnered with Lauren at CHC Addiction Services, and I did a video gaming focus group with some of her young people. So I was able to jump into one of their virtual calls during the month, and it really helped open my eyes a little bit, Lauren's eyes. And then there was actually a school counselor that also regularly sat in on those fun calls that they normally do. And we just had conversations about video gaming and asked them about what kind of video games they played, if they heard of loot boxes and knew what those were. And it was a really great conversation and discussion. So that's something I would say is that let young people teach you what they know about video games. I think that's really helpful. The other thing that I did recently that was another great way for me to virtually reach an interesting population is that our local, the Lake County Adams Board, who gives us funding, actually has regular meetings where they bring in different programmers just to talk about and share about the things that they're doing in the community to the board members. And so I was recently asked to speak at one of their presentations. And many of the board members that were on that call had never heard problem gambling prevention information or education before. And what was supposed to be a 10-minute conversation and a 10-minute presentation ended up being over 20 minutes because they had so many questions and so many things that they wanted to ask and talk about. And that was something that I was really blessed to be able to do. And I think that if you're able to get into, if they're doing virtual calls or things like that, talking with the people who are providing you funding and seeing if they're able to have you connect with other people's agencies and those types of services as well. So those are my long list of a variety of different things that I have found to be successful virtually. And yeah, Joy, I would agree. We actually have tobacco cessation at our agency, brand new. We are the only people locally who provide tobacco cessation, but we have a coalition that's recently started up that I'm also relying on quite a bit. And I know that you're talking with Lauren a little bit about it. Oh yeah, Janine from Zeph Center, she has a really great resource that they've been able to talk about when it comes to gaming and gambling, if you're curious about that. So she put that YouTube link in there as well. So I know I can talk forever. So I'm gonna pass it off though to Nabil, because Nabil also does a lot of great other things over at Recovery Resources, which is just a little way away from mine, and we partner together in a lot of things as well. So Nabil, it's yours.
Sounds good. Thank you, Claire. I just have to say, It really is a breath of fresh air, just hearing all the great prevention work being done, throughout Ohio. And so, I just wanted to kind of let everyone know, this is such a treat, really, to just kind of hear all the different programming that's going on, and it's so awesome to be a part of this. And so, my name is Nabil Pervaiz. I'm the gambling services coordinator at Recovery Resources. And so at Recovery Resources, our prevention and wellness team work with folks of all ages, from preschool, the little ones, all the way up to seniors. And so these are kind of the 4 categories I wanted to touch on today: our programming, community engagement, platforms that we have utilized, and then even our methods for documentation, data collection. And so next slide, please. And so each platform here on the screen was good. It was great, right? So the key here is to really familiarize yourself with the different features. So that was something that very early on, at the beginning of the pandemic, we were looking at, Microsoft Teams, we were using WebEx, then we started using Zoom. And so when we were in person, there were, a ton of different activities that can entice someone to learn. And so that was something that we really needed to kind of pick up on when it came to these platforms, right? How do we utilize these platforms to keep that going? How can we continue to entice learning in our little ones, all the way up to the seniors? And so when we learn the features in these virtual platforms, we can continue creating that space for learning and make it fun. And so other platforms that we are aware of that we are looking to use, which I didn't put it on the slide here, but I did want to kind of touch on a little bit. 2 other programs are Pear Deck and Nearpod. So those are other for any youth-led programming or any youth programming that can allow students to kind of have or take advantage of other interactive activities. Some of the things that we have been taking advantage of, utilizing whiteboards for interactive activities, breakout rooms. The breakout rooms are such a great aspect to these platforms. So the breakout rooms allowing anyone and everyone kind of that space to decompress, kind of think about what they've been going over, what they've been discussing, and then really utilizing breaks too, right? We all understand that if we are working from home, or if we're participating in a webinar or any kind of session and we're at home or we're in one space for a very long period of time, breaks are such an asset, right? So taking those breaks, and one of the things that even myself that I like to take advantage of are using timers on YouTube. So YouTube, there are tons of different like countdowns that you can kind of incorporate, so you allow people to physically see, this is a time that I have that I can be mindful of, how I feel, what's going on. Do I need to get up, stretch? Do I need to open the window and just kind of take a deep breath, right, and get some fresh air? And so as far as our programming, so if we can go to the next slide. So during COVID, we have continued to follow through with the fidelity of the programs that we offered by really focusing on and utilizing the social emotional learning aspect of our programs to allow participants to work through any COVID related stress. So some of the examples of adaptations for our programming. So here I've listed, we offer gambling prevention education, our Prime for Life drug and alcohol education class, active parenting, Boffin's life skills, healthy alternative for little ones, project success, and then even our Casey's kids. And so with our gambling prevention, we have been meeting with groups in somewhat of a hybrid style. Some of the groups are virtual. A few of them have been in person. And so we really started to take advantage of utilizing SurveyMonkey when we do have those screens, or when we are screening clients who are virtual. So the presentation discuss the basics of problem and responsible gambling, but also look at making the material relatable and current as it relates to the experience many of us have had over this past year through stress, boredom. And so we've also been creating more of a social media presence, where we've been really pushing that and trying to promote, responsible gambling. So in a little bit, I'm going to ask Ashley to play a quick tip video. I just wanted to mention that alongside the quick tip videos, we're also currently working on putting together quick videos, hearing from people who are in recovery, hearing from people who have been impacted by problem gambling, and also professionals in the field, right? Hearing from treatment professionals who work with gambling clients to kind of see and hear what's going on there. So we'll go ahead and take a little bit to kind of watch this quick tip video.
Let me know if you don't hear the sound, Nabil.
Hi, I'm Nick, and I'm an outreach prevention specialist here at Recovery Resources. And March is Problem Gambling Awareness Month. We will be sharing tips on safe gambling. Create balance, time with friends and family to create bonds and reflect and reaffirm values. If you or someone you know needs services, please feel free to reach out for an appointment.
Thank you. So yes, so that was one of our quick tip videos. So throughout Problem Gambling Awareness Month, our plan is to push a lot of these videos out throughout the month. We are predominantly using Facebook, Instagram, LinkedIn. Like I said, trying to get these videos out there, even hearing from other folks in the field. And so for Problem Gambling Awareness Month, we've also partnered with local convenience stores, gas stations, restaurants to use kind of to-go bags, takeout bags, stickers to close up those bags, and on those stickers having problem gambling awareness information, and then even a QR code link to our services at Recovery Resources. And so that's something that we actually just started with, March being Problem Gambling Awareness Month. So I know I've already heard back from a few of our partners in the community who have said that they're already starting to run through these bags and stickers a lot quicker than we had thought, which is a good thing, right? We're really trying to promote, that advocacy and getting that information out there. As far as our other programs that we offer, so Prime for Life is a drug and alcohol education class, predominantly for the adult population. And we have been trying to tying in COVID through examples. So throughout, we utilize examples, we create discussion. And so we've been trying to incorporate and include, having those conversations about what's been going on this past year, right? How can this impact our drug and alcohol use? And, even talking about someone using out of social isolation, right? So kind of talking about that topic as well. With our active parenting classes, working on building consistency in life, right? So one thing that we can all agree on with the pandemic, that it created this lack of consistency, right? There's so much was going on, especially right in the beginning. And so we all had to take that time to transition and to kind of be where we are today. And so with our parenting classes, that's kind of one thing that we really wanted to push was, how do we create that consistency? Life skills, really giving the floor to the students to speak, meet virtually with our specialists to discuss, different stresses going on, right? So really focusing on any separation, stress, social isolation, any feelings of the unknown. And it allows the student, it allows us to approach the student in a different way, right? Really hearing them out and kind of talking through what's been going on. Halo, our healthy alternative for little ones. This is for the little ones being around the ages of 4 to 6 years of age. So we've really been pushing, having them watch videos of, people reading books. We've been reading books, right? Really trying to incorporate some of these other skills, other aspects. And so we've also been giving them what we call brain breaks, right? So we know that being on the computer for so many hours in a day can be exhausting. So especially thinking about the little ones and thinking about what they might be experiencing, we want to give them the time to get up, stretch, dance, right? Sing if they need to, right? Get up and move. And so the videos break up kind of the monotony, right? We're not just trying to talk at them, because in this virtual world, it's so easy to kind of hop on and just talk to everyone, right? Ashley, you made a good point of, thanking everyone in the chat for adding to the chat, right? Because for us, it just feels like we're talking to the void. And so depending on the group sizes of these classes, it can almost feel the same way. And so icebreakers have been also, really allowing students who maybe haven't had the chance to meet each other yet, really giving them that time to get to know each other, right? So we're really trying to promote those, the different social emotional learning skills. And then Casey's Kids, one of our other programs, Casey's Kids was established to encourage leadership skills for school-age children, to really teach those techniques to resist any peer pressures from alcohol and substance use. And so we did recently hold our youth summit virtually this year. So that was back in January. Normally we have, in the past, we've had a location where, the students from different schools, teachers, would come and, we would use that time to really give the students a voice in a way that kind of releases that stress for them through social interactions and discussions. And so that one, I believe, the age group was about 7th to 8th graders into high school as well. And so I believe we had around 70 of those students that were in attendance this year. So that was something that we were very excited about, just because we were going from a program that normally is in person to now something that's virtual. Next slide. And so with community engagement, just a little background for our coalition. So the Cuyahoga Problem Gambling Coalition was created back in 2014. We are the only gambling specific coalition in Ohio that is committed to ending problem gambling in our community. So we're always welcoming further engagement. And since going virtual, we've been focusing on virtual webinars, events, and really trying to think outside of the box. So for anyone here who is participating in today's session, it's possible you might have been a part of our October professional development webinars. We had a 3-part series. And so even then, looking at going into the future, we're really trying to think of different ways that we can include networking events, because that's the one thing we kind of recognize that's missing through the virtual world, right? Is that this idea that all of our sessions, all of these webinars that we're a part of, we kind of attend and then that's kind of it, right? So we are looking to, going forward, creating more events that have that networking aspect. And so some of the pros and cons here of going virtual for our coalition meetings, it allows more people from much farther away to join our meetings without having to drive anywhere, right? So there's kind of that ease of access there. Comfort of being at home or in the office, flexible timing. The main con that I believe we saw was really just internet connections can make it hard to hear. And sometimes too, if we aren't as tech savvy with, utilizing these platforms, that can also cause a little bit of a challenge as well. But after, when we get to a point where we can meet in person, the goal is still to allow that virtual aspect to be there, right? So allowing people to attend coalition meetings virtual, while maybe some others might be attending in person. And so that allows us to really expand kind of that outreach of further engagement. Next slide. And so with our documentation, data collection, this was kind of almost a little bit of a timeline here, right? When we first got into the pandemic and we were trying to think about how do we go about collecting data? What's a good process here, right? So we kind of started off with utilizing Word docs for pre-post tests and things like that, PDFs, and then we kind of ended with SurveyMonkey. SurveyMonkey, was an easy way for us to add all that information there, send it to any clients, any participants in groups to collect that data. And just like Clara had said, we also use the BBGS as well for our when we meet with our gambling participants for these different groups. And so using SurveyMonkey to collect the data, we would, even for the AOD side of things, we would send them to teachers, then they would either provide them to the students, or depending on the age of the student, they would fill it out themselves. And so a key thing here that we've come to realize is that really having a good working relationship with the teachers in schools will help the most. And so for the last slide, applying appropriate prevention messaging to COVID-19. So these are kind of some of the things that we really want to focus on, right? Avoiding shame, scare tactics, because we know as preventionists, we know that these things don't work, right? So parents and screen time, I know Claire mentioned that, focus on finding healthy balance, promoting coping mechanisms, social emotional learning, really thinking about how can we be mindful and how can we utilize any kind of meditations to help us during this time. Really focusing on that connectedness, thinking about alternate ways to connect during social distancing, hearing through, we were talking about gaming and through social media. And so adapting self-care methods during the quarantine and acknowledging any current traumatic effects or events, any social unrest, in COVID or during COVID.
Well, thank you. This has been so much fun. I really enjoyed the chat and being here with all of our presenters. I know I saw a couple of questions for you, Nabil. So someone asked, and this would be applicable for anyone working with schools, teens saying they don't like to go to school. Have you heard any positive feedback from students and virtual learning? So if anyone wants to chime in, feel free to unmute.
The students that I've worked with when it comes to virtual learning, they seem to enjoy it because of the schedule. There's a little more flexibility depending upon the school district. I know a lot of kids, when they went back to school in person full time, 5 days, they were like, now I don't get to have a day off. So, it's kind of interesting how they view it now. But it's like, hey, you went to school 5 days before and you were interactive. So, so that's what a lot of my students that I work with virtually say, is they like the flexibility and the scheduling. But I think they're lacking the interaction, the face-to-face type of interaction, and they'll tell you that. So
I'm just going to pop in and let everybody know. I'm going to go ahead and launch the poll question for this session. Again, this session, or the poll question, is just meant to be a verification of attendance. So that will be up as we continue Q&A.
I'll jump in and ask a question. Yeah, I'll jump in and ask a question for anyone, but maybe I'll direct it to Lauren because I know she does so much. I'm curious, Lauren, just your thoughts on, well, first of all, thanks everyone for sharing all that information. You're all doing so much, and over this difficult year when so much of prevention is making those connections and relationships. So of course that's more difficult virtually. But I'm thinking, looking into next school year, because you do so much school-based programming, Lauren, can you talk about maybe potential barriers or how you plan to overcome them if and when different schools that you do programming with have different setups? So if one school is all virtual still, one school is all in person, and a third school is half and half. How do you go about navigating how to then implement programming when you have to do it a different way with every school? And I think you.
Okay. Good question. There we go. Luckily, I have an awesome team of 2 other prevention specialists that help out. So we kind of divide Summit County and the school district. So, but we work so well together, and we have such a great relationship with the schools that, I've had one school that has been in person all day since day one. And then other schools that have been virtual and just going back in person. So it helps having that relationship with them already established. So we're able to navigate, and what does your school need? Okay, let's see what's going on here. Let's schedule this out. And if I can't cover it, one of the other prevention specialists can. The nice thing about the virtual platform has been, I've been able to be at 4 different schools in one day. Whereas if we're in person, it's hard. You can't do that. So, so it's kind of been tricky on in that regards, but we're making it work. And like I said, I just have a wonderful team that we're supportive of each other. And when the teachers and the school districts know what's going on, they let us know and say, okay, we're ready for you. We're not ready for you. Let us get settled and we'll let you know. So it just kind of depends, but that working relationship, which has been established for years, is a blessing.
Yeah. Great. Thank you. For Ashley, I wrote this down and made sure I wanted to sneak it in. Joy in the chat kind of mentioned community engagement and how a virtual meeting is nice because people can go home and come back on. I remember our days of chairing the coalition up in Cleveland, and struggled isn't the right word, but we always discussed, when do you do a community event? Right after work, so people go from work to the event? Do you allow them to go home and hold an event at like 7:30 because maybe people aren't going to go back out? So we did it all different ways. Can you just comment maybe on how in the past you've done community events to get that engagement and participation really, and how, Zoom things can help in that light, because it can be hard to get community participation when it's not their job to be at a meeting like it is with us.
Yeah, I would say that's been interesting, as most of our NAMI programs are for the general community, not professionals. So having that is a benefit of online. For example, we did a mental health first aid training from 5 till 9:30. Well, I did not love that. I would be much more willing to do that online when at 9:30 I'm in my house. I can just, I'm done for the day. I don't have the whole hoopla of packing up from a training. And also, as someone with a small child, that also made it much more flexible. There were things I was able to attend or do that I wouldn't have been able to do if it was in person because of childcare obligations or different family obligations. And so I think having it online, if you, let's say, or actually, here's a good example. We've never offered family support groups during the day because typically our folks work. But now that we're doing virtual, we're exploring a lunchtime support group that folks can join on Zoom. So you might not have been able to drive out to our site to attend a support group, but now that it's over Zoom, you can join. Or here's another great example. We had family members that they would be at a child's sports practice, but they could still join our support group in the car while their child was at practice or things like that. So the virtual model opens up the program to a whole new audience of people. And I did share in the chat, we purchased a product to do hybrid meetings called the Meeting Owl. It's pretty pricey, but if you can get some good grant funds, maybe it's something you can get. So it sounds like a lot of folks have that goal of how can we still leverage the benefits of virtual, but also the benefits of in person.
Absolutely. That sounds really interesting. Well, we're at time. I was just scrolling through the participants. I mean, great to see so much conversation going on in the chat, and there are so many other, giants of prevention, if you will. I mean, I see Mr. Kevin Ringer, my friend, George Hicks, Jose Flores. I mean, there's so many people that weren't able to be on the panel that are probably doing a lot of awesome things. So I hope we can maybe do something similar to this again, maybe in the summer, to see what other folks did and what they plan to do in the upcoming year, to hear from some more folks around the state as well.